This is a video for my MBLEx massage board licensing examination students. Today is July 11th, 2022. We're going to go over the basics of joint movements, flexion and extension. So this is head flexion at the neck or neck flexion, neck extension, wrist flexion, wrist extension, elbow flexion, elbow extension, shoulder flexion and shoulder extension, flexion of the thoracic spine, extension of the thoracic spine, flexion of lumbar spine, extension of the lumbar spine. This is hip flexion and hip extension. This is also hip flexion and hip extension. Knee flexion, knee extension. And unique to the foot is dorsiflexion, which is a kind of extension, and plantar flexion, which is true flexion. Abduction and adduction. When you abduct, you take away from the midline, so this is shoulder abduction. When you adduct, you add to the midline, so this is adduction. Abduction, abduction, adduction. Likewise, this would be abduction of the hip or leg, adduction of the hip or leg. Medial versus lateral, medial and lateral rotation. This is medial rotation of the shoulder. This is medial rotation of the shoulder, and this is lateral rotation of the shoulder. If I raise my humerus, this is medial rotation, and this is lateral rotation. So the way I think about this is that medial rotation is like the forehand, and lateral rotation is the backhand of a racket swing. And then lateral rotation or external rotation, which are the same, is like raising your hand this way to signal a turn, and that way to signal a turn or a stop. Also, if your arm is straight, this would be lateral rotation, and this would be medial rotation. You concentrate on the humerus rather than the forearm. At the forearm or the elbow, if that moves alone, the action of the elbow or the forearm is supination and pronation. Supination and pronation are unique to the forearm and wrist or upper arm. And then medial and lateral rotation of the hip. So this is lateral or external rotation. This is medial or internal rotation. Lateral, external, medial, internal. Let's see, elevation and depression are unique to the scapula and the clavicles. The clavicles and the scapula or shoulder blade, they're a unit along with the humerus. Clavicle, humerus, scapula. So you think of the scapula and the humerus going up, that's elevation. Going down, that's depression. Elevation and depression. If your shoulder blades are spreading away from each other, that's protraction. And if you're squeezing them together, that's retraction. Shoulder blade protraction, shoulder blade retraction. Okay, supination versus pronation, we covered that one. Inversion versus eversion, that's unique to the foot. So on the foot, get a little assisted hip flexion here. So this is inversion, and this is eversion. Inversion, where the inside picks up. Eversion, where the outside picks up. Maybe I better show you that on the floor. Here's the floor belongs to the dog. This is his domain. So inversion looks like this, and eversion looks like that. Inversion, eversion, which is unique to the foot and ankle. Okay, a couple more specific movements. For the neck and the spine, there's also lateral flexion, right? And through the spine, lateral flexion looks like this, like side bending. It was kind of good, I'm kind of stiff. Okay, some specific movements of the shoulder. Horizontal abduction. So horizon, right? So this is the horizon. So this is horizontal abduction, right? Going away from the midline, and horizontal adduction, right? Then there's diagonal abduction and diagonal adduction, right? Diagonal abduction, diagonal adduction, horizontal abduction, horizontal adduction. And then circumduction, which is one of my favorite movements. So circumduction looks like this. So anytime you see a limb moving in a cone shape, where my hand is the wide circle of the cone and my shoulder joint is the point of the cone, that's circumduction.